AI will replace healthcare workers within 3 years. I just got back from a medical AI conference, and one of the keynote speakers said something that really shook me. He said that AI is going to replace most of the healthcare workforce within 3 years. Not assist, not augment, replace. That includes doctors, nurses, physical therapists, respiratory therapists, support staff. The list goes on. Basically, AI will handle diagnostics, documentation, and all patient communication from scheduling to billing to medical records.
Medical professionals or anybody looking to be a medical professional, please just listen to me. So be very careful. If you have not already made the decision to go into medical, you might want to think twice and make sure you double check a whole bunch of boxes because AI is literally taking over. If you have not heard of Agent Hospital, look it up. It can treat 3,000 patients in one day with 0 human assistance. That's a robot. We also have things that are being piloted in labs, taking over lab assistants, taking over the scientists in the lab. We have people or programs that are taking over radiology positions because they can diagnose and put a treatment plan together for x-rays, CT scans, MRIs, quicker with more accuracy rate. And then we've got things like the Da Vinci for surgeries where it's completely, you're almost eliminating the human need in surgeries. It's the accuracy rate and the error rate is corrected by so much in so many areas. We also have things that are being piloted in the US, like little robot machines that come to the patients and a doctor can operate it from outside of the area. But again, we already got a robot that can treat 3,000 patients in a day. Be very careful when looking into the medical field. Granted, a robot cannot take over the empathy and the specific care that humans can give. But when the accuracy rate is a lot higher and we have so many issues with people who are getting into the medical field for the wrong reasons and then tainting that field for the ones of us who are like really good and passionate about what we do, it's going to make it a whole lot harder for us to be able to fight against this. So if you are not somebody who has a complete passion for medical care, please just go in a different direction. If you are in medical care and you don't have a passion for it, put in a 2 weeks notice, please. If you do have a passion, fight, show that your care is needed, show that the opportunities that you give as a human being are needed in the medical care. And again, look up these different things. And if you're looking to get into the medical field and you have a passion for it, make sure that you are looking into a field that will last, that you will be able to have a foothold in for a very long time to be able to provide for your family.
Hey YouTube, lately I've been seeing a lot of people talk about AI taking over healthcare and completely changing the way patients interact with doctors and hospitals. So while you watch these TikToks, I want to talk about what the future could actually look like and why so many people seem so divided on it. Because even though AI can definitely be useful, I think healthcare is one of those areas where replacing too much of the human side can create problems that technology alone can't really solve.
I'm at the biggest AI conference in the world right now, and these are the 3 biggest issues that people are talking about regarding AI and healthcare. One, and probably the biggest, is patient trust. For example, people are developing AI solutions like a chatbot to call a patient after they're discharged from the hospital to answer questions they might have about the admission and to prevent readmission to the hospital. But the question is, do the patients even want this? Do patients know it's an AI calling? Are you going to pick up the phone if you know an AI is on the other side? So that patient trust is probably one of the biggest things that needs to be solved. Number 2, there's a lack of patient consent that's obtained relevant to their medical data, especially in the acute inpatient hospital settings. For example, a vendor that's affiliated with a hospital might be able to access your data that you didn't even consent to, and then this is being sold to these vendors now then to create AI models off of and then profit off of, which the patient doesn't get any part of and they don't even consent to it. And number 3 is everyone says that they want to build safe and effective AI solutions in their hospital systems and clinics. But the problem is how that AI tool is actually measured. How is that effectiveness measured? Are enough parameters looked at, and are important outcomes such as quality of life, length of stay, etc., are actually assessed or not?
I am a first-year medical student and I'm pretty interested in radiology as a specialty. A lot of times I'll talk to people about like what I'm interested in, people that are not in medicine, and they will ask me, don't you think radiology might get replaced by AI in the future? And a lot of people comment on TikTok and stuff saying, first of all, I think most of the people that say that don't know anything about AI and they don't know anything about radiology. Second of all, human anatomy is so incredibly nuanced. No, I'm not worried that it would take over at least anytime soon. I think AI could take over anything eventually in some point, but like very far down the road. Anatomy is so nuanced. It is so complex. I think the average layperson doesn't understand just anatomy alone, how complex it is. Like in our anatomy lab, like the 10 human bodies sitting next to each other, none of them are exactly the same. When you think about tens of thousands of patients trying to see what's on the inside of their body without opening them up by looking at pictures of them on a computer screen, so incredibly complex. It is maybe one of the most complex things in medicine, and I think it gets overlooked really hard. Then you're trying to find what's wrong with people, and sometimes, I mean, there's new things that happen every day. I've shadowed trauma radiology a little bit, and like, no cases are exactly the same. AI is good at pattern recognition, but what happens when something's completely new? I don't know about you guys, but after seeing and working with AI a good bit, I would rather trust someone who has seen millions of human beings in a computer, to be honest with you. I know that might be a niche take. There's like no way that the technology available right now, at least commercially, could do that. And even if the best of the best technology could do that, it is not going to be widely available. That's going to be a luxury for some people. What happens when it's something that you've never seen? You need the critical thinking that I think, what it seems like to me, radiology residency trains you for. Most patients are not textbook patients. Nobody's a perfect Netter diagram. So I'm not worried about that.
Alright, so one thing that worries me a lot about AI in healthcare is how much of the patient experience could be automated over time. A lot of hospitals are already looking at using AI for things like scheduling appointments, checking with patients after visits, answering questions, and handling follow-ups. And to be fair, I can see why that's appealing because healthcare workers are already overloaded and AI can do these tasks a lot faster. I think the problem is that healthcare isn't the same as ordering food or contacting support, you know what I mean? When people go to a doctor, they're often stressed, confused, or worried about something important. A follow-up call might seem like a small thing, but sometimes just talking to a real person can make someone feel much more comfortable, you know what I mean? And if more of those interactions start being handled by software, some patients might feel like they're not talking to a person. Some patients might feel like they're talking to a system instead of receiving actual care from a doctor, you know what I mean? Sure, the information they get might still be accurate, the appointment might still get scheduled, and the reminder's still going to get sent. But since the beginning of time, healthcare has always relied on trust, and trust is harder to build when fewer people are involved in the process, you know? That's why I think the biggest challenge isn't whether AI can do these tasks, but whether patients will actually feel comfortable with it.
Folks, I've been telling you that the world is moving fast. It's automation, it's artificial intelligence, it's robotics, and you keep thinking that this is the future. So today I try to give you real life examples. So today I come get a blood test for one of my policies, and I'm in this beautiful medical facility here, all right? And it's very nicely done, right? Very nicely done. Everything about it is, first rate, right? And, I'm impressed with the facilities, and all of this is, very beautifully done. Very beautifully done. But upstairs, and I'll show you a couple pictures. Upstairs, when I go, one thing you're noticing or you're not noticing are a lot of employees running around. Looking at this hallway, right? Not a lot of employees walking around. And upstairs, I'm being quiet because I probably shouldn't be doing this. I just got to show you. So upstairs, I go to get my blood test, and I've never seen this before. I walk in the waiting room, and there's no reception area. No employees, no reception area, no window, no one talking to you, nothing. It's a machine, just like you go to Taco Bell or Burger King or go to a restaurant, increasingly restaurants, but look, they've automated it, and I had to check myself in, give my ID on the machine, my insurance card or whatever it is, and it gives you an appointment. It tells you can either chill there or go away and come back 10 minutes before your appointment. They just reduced, and whoever owns that, and it's a business, right? It's a medical lab processing facility, and they have to be certified and get state and federal certifications, but it's business. It's owned by somebody who's a capitalist. And they just cut out 20% of their costs because they only have lab techs in the back. Nobody up front anymore, no reception. So if you have a high school education and no hustle, and you just want to chill, this economy's going to eat you alive. You've got to get AI and computer and technology efficient and literate, and I mean quick. This world and this economy is changing fast, and you've got to change with it. I'm not trying to scare you. Well, I am trying to scare you straight into a new reality. I want you to be employed. I want you to be, jobs not going to go away. This is not the end of jobs. AI is not going to take your job. Your job's going to be taken by somebody who can use AI and robotics and technology. So I just want you to be in that number. John Hope Bryant, get the podcast. Listen to my Straight Talk Live series. Watch that one. Listen to the podcast. Get my new book, Capitalism for All, bestseller. And go to Operation for Coaching and Counseling. I'm out. This is deep.
A lot of the conversations around AI and healthcare focuses on jobs, and I understand why, because hospitals and companies are always looking for ways to save time and reduce costs. The first roles could be affected are probably administrative positions that involve paperwork, scheduling, documentation, and other repetitive tasks. Supporters of AI often argue that doctors and nurses don't need to worry because healthcare is far too complicated to fully automate. To be honest, I think there's some truth to that. Doctors aren't just reading off a screen, you know what I mean? They're making judgment calls, communicating with patients, noticing things that software might miss, and taking responsibility when important decisions need to be made. At the same time, technology usually doesn't jump from nothing to doing everything overnight. It tends to take on more and more responsibilities as people get more comfortable with it. That's what makes this conversation interesting. The concern isn't that every hospital gets rid of doctors tomorrow. The concern is that more and more decisions gradually get handed over to a software because it's faster and cheaper. I think AI can be incredibly helpful when it's used as a tool to help healthcare workers do their jobs better. If it helps doctors save time, catch mistakes, organize information, and focus on patients more, that's a good thing. But if the goal becomes replacing as many human interactions as possible, that's where I start to have concerns. Because when it comes to something as important as your health, most people still want to know there's an actual person involved in the process. Let me know what you guys think down in the comments. Hope you guys all have a great day. Peace out.